Hi, it's Dr. Pat again from Walsh Wellness Center. Today I want to talk about the autonomic nervous system. Now, to begin with, that's what we do. We treat subluxations. What's a subluxation? Good question. Sub, less than, to luxate, dislocation. So it's a joint that's stuck. It's not moving well. So that can put pressure on different nerves. From the spinal cord, you have spinal nerves that leave both sides, okay? And out of those spinal nerves, they run certain things. So there's three types of nerves, right? There's motor, that moves. There is a sensory, that is, everybody thinks of as pain. That's a sensory nerve. There is proprioceptive. There is pins and needles when you feel that pressure, temperature. Those are all sensory nerves. And there's the autonomics. That's these things. Autonomics, think of them as they're automatic, right? Your brain talks to every cell in your body, either directly or indirectly, and these are the functions, organ function. We wouldn't let you to control your own organ function, so the brain's going to take care of that for you, okay? There's two types of autonomics. There's sympathetic and parasympathetic, and what they actually do is they raise or lower basically the function of whatever organ or whatever they're talking to, okay? So there's three sections to the spine, okay? There's the cervical, that's the neck. There are 7 vertebrae there. Thoracic, which is everything with the rib. So there's 12 vertebrae there, and your lumbar, which is 5. So there's 5 vertebrae there. And this is a simple diagram, basically, of going over what is connected coming from where out of the spine. Okay, so when the cervical, the neck, right, the 7 there, basically it's going to take care of everything in the head, the face, and the throat. Okay, so everything from these functions of salivary glands you don't think about, right? But they do. You don't have to think about the creation. Mucous membranes, they even have some eye control, right? As you move down from the neck, you have the thoracic. Now this is the interesting part, because now you're getting into the major organs. Now the brain needs to talk to all of these, right? The brain doesn't need to control, actually the heart will beat on its own, but raising the heart rate, lowering the heart rate, that's an autonomic function, okay? Lungs, here's something, stomach, liver, all of these organs need control by the brain. And if you have a subluxation, that could go ahead and interfere with the talking of organ to brain, brain to organ, right? So that's what we do. We treat the subluxations. I've had patients with different organ dysfunctions that were helped with subluxation. I've had a number of them with some sort of digestive issues. One of the most recent, I had a 5-day-old child who was having problems voiding, hadn't voided since the child was born. Came in, examined, adjusted, and that was a Saturday morning. She called that morning to want to get in right away. She called me back twice later that day. He voided, and then twice the next day. And I think she even wrote up a little thing, if you want to read that on the page. But that is how we can actually affect some of the organ function, right? Because if you move the interference between the brain and the organ, communication improves, function improves. In the last section you have here is the lumbar, so you have 5. So really you're working from the top of the thoracic, from the organ function, and you can see over here from the heart to the lungs, to the stomach, to the liver, to blood vessels. That's a good thing too, the blood vessels. You have smooth muscle around arteries, right? So that smooth muscle will contract to increase blood pressure. It'll open up to increase blood flow, okay? So here's the condition here. Orthostatic hypotension. That's when you move, say from lying to sitting, sitting to standing. Blood pressure isn't adjusted because now you're going against gravity. If you're laying up and you sit and you stand, you're going against gravity. So really what happens is the brain senses that blood pressure is dropping, and this happens instantly. And then what happens is it will put pressure back into by squeezing that smooth muscle around arteries. So if you ever got up too quickly and you're a little dizzy, that's your system not adjusting quick enough, okay? So that's just how, now think about you walking every day, not just getting up, but walking and moving and stressing, and maybe you train, maybe you resistance train, maybe you run. These things make your blood vessels have to adjust to the pressure, right? More pressure, say if you're weight training, especially heavy, what's going to happen is you're going to need to increase that to overcome that pressure, right? So that's another way that the autonomic system works every day, every motion with you. As you move down, then you get to the lower and lower parts of the organs, right? All the way through the digestive system and the colon, kidneys, bladder. It hits every major organ and everything, because the function depends upon the nervous system itself. Now that's just a quick little overview of the autonomic nervous system. As chiropractors, we're not just pain. We're not just pain. Everybody thinks of us as pain, but I think of us as improving the nervous system function, right? And not all nerves are sensory nerves. I've had a number of different patients come in for a lot of different reasons, and not all of them are spine either. You might have radicular issues from sensory, from going down the arms, going down the legs, to weakness. But with what we do as chiropractors is we're working not just with different parts of the body, but it's the nervous system that we're most interested in, because it covers everything you do, from pain to discomfort to strength to function. So I hope that helped out a little bit. Probably confused you more. Probably have to redo this. But if you like, press the like button, follow, and let your friends know. I appreciate you.